Indeed, it was a wonderful experience to listen to you, Professor Mahendra Kanam. Now, according to the CEO, we can take very few questions. In fact, we are an hour behind of the whole plan. However, since we have got a very distinguished participants over there, so we can take very few questions. Then I will hand it over to Dr. Varnapurna and we can put it in the committee. And I have one question to Dr. Mahendra Kanam. In your presentation, you mentioned that few patients they suffer from fatigue. So I want to mention actually naturally around 2% patients are being recovered from fatigue. But you know that fatigue is a very exposed disease and basically it is means for health education, health promotion and minor cases. And the market is complicated patients. Most of the patients lately they are attending over their family. So obviously few patients are being complicated. But another thing you mentioned that they are using actually referred in the last year, actually, in the last part of student year, we provided this referred and also case series, we have been paid in the last part. So I think after the taking of the case series, this will be used for money. So I think when, I don't know actually when this study was done. Actually, I want to know this. Yes, please. Any more questions, please? Yes, this first.
Ideal scenario, what should be the ideal scenario for MIS and the patients and very well suited MIS center or MIS center to the world. But I have seen the challenges currently affecting the MIS system and the referral system. And what would be the potential threat or the potential challenges that we need to meet, and we have to have the preparation for meeting all the challenges. So actually I will request the court here to discuss on this issue in this thing that the challenges we are facing. Thank you very much.
Thank you. He will cover it in his deliberation. Sure. Next, any more? Yes, please. Gentlemen over there.
I'm not sure that it was being evaluated that the patients who are being admitted in the medical hospital or district hospital, how many patients are truly going to be referral patients? I think there is a missing link that we are not, there is no record available in the district hospital that how many patients are coming as a referral patient. I believe it is secondary level referral patient. So this thing needs to be addressed as
for your question. Yes, we have reported on the one-sided referral from the place where the referral was done, and there is another scenario. I mean, how many of these patients were reached to those right places. So I haven't presented that part, but we have data, and we look forward to analyze that and reporting to you.
Okay. It's on screen.
When a patient is referred from, this could be the effect, this specific referral system. When a patient is treated in the hospital, that is in the tertiary care center, and often the expert visits and consultations could be possible with affordable range by arranging the expert panel opinion at the primary and secondary care level. So this will be lots of patients.
Health centers can take off some of the load. You know what happens in the Western world, because I work here, a patient who was very sick, referred from the original responder to the district hospital or district to medical college. The patient, after treatment, getting better, doesn't need to be there with that. So with the same downward referral being sent down, that is called step down, and they are setting the dates for even more cases. That's the system of downward referral, but that works very much in the developed countries, needs to be developed here also. Otherwise, it will go work for the limit of service.
I have many of the comments made by the presenters, but I can also see those who are those. But the first question I'd like to ask my audience, because what I have observed that all the presenters, they have praised the importance of health information system in improving the referral system as well as in improving the overall health situation of the country. Now, my question is to the audience. whether they also recognize this importance. If they say yes, then I shall actually go for further. You know, you say yes for that, you recognize the importance. Anyway, I think let us start make us working, right, of the referral system of the country or the health delivery system of the country. So you can see the more of the facilities, for example, the community clinic, the union health facilities, as well as those who are actually health complex in the area. And they could see whether the individuals who need to visit the hospital or health facilities, whether actually they are visiting or not. So that system should be established. Again, in the country you see that all the district hospitals, they work in isolation. They do not have any effective linkage between Lutherville Hospital and Assam Mental Hospital or Kashmir Hospital. They all, each district hospital or each Lutherville Hospital, each Medical College Hospital, each Kashmir Hospital, even the University Hospital or National Medical Institute, they work in isolation. So if the name of the institution is called National Institute of Cardiovascular Disease, their actual responsibility should be for prevention and control of cardiovascular disease for the whole country, because its name is National Institute. But you know, the hospital load currently in the country is the captive. If the patient comes to the hospital, they will treat the patient. If the patient do not come, they will not treat the patient. So actually we like to reverse the situation, or we need to reverse the situation. The second one I can actually quote from Dr. I think first I like to quote from Professor Shahidullah's comment that he has mentioned that the hospital should know who are the patients being referred from the lower level hospital or from the higher level hospital. And hospitals themselves should prepare themselves to receive the patients who will come to the patient. This is one. The second quote actually I should take from Dr. Arya's presentation, that she mentioned that doctors must stay at the station to see the patient. And they should be responsive to the need of the patient. So these are the fundamental questions. If doctors are not available in the station, right? So who will take care of the patient? The second one is, if the doctors are not responsive, they do not care, they do not respect the patient, actually who will adequately actually take care of the patient? So first of all, actually these two fundamental questions should be resolved. Okay, and I think the audience understands the situation of the Bangladesh healthcare facility. So if the doctors are not present there, and the doctors, the leaders of the health system, right? If the doctors are not present there, how the support staff will take care of the patient? So first of all, this is a fundamental question that we have to resolve these issues. Actually, when I was here, I was also thinking that there are two limitations of this, I think this session. One is that there is limited time and there are many presenters. And the second one, actually, Dr. Nadia was actually mentioning, the same thing I was thinking. Because we have discussed wider issues of health management information system. But the focus of the discussion should be how we can improve the referral system and how the health management information system can help improve the referral system. That is the issue. So now, actually, how we are thinking. I think all the presenters, they have described the ideal situation. And all the components in our current program, we are trying to actually implement. So actually, ultimately, in Bangladesh health sector, we are actually going to have a system which is standard. Okay. And we are currently working with one bank to actually we also include 2 more hospitals. The idea of the initial project is to customize the software so that all the hospitals can use the software. And the purpose of this software is actually introducing an electronic health record in Bangladesh. And this is nice because our foreign representatives actually described to you. But our software is OpenMI. This is open source software. We didn't require any money to buy it, but we are customizing it to fit to the local situation. Once the software will be ready, the software will be distributed to all the public hospitals and to all of the private hospitals free of cost. So that in the country, actually a uniform system works and the data can be put into the central system. I do not know whether actually Mr. Mark's software or it works only in one hospital or it is designed for multiple hospitals. Because if the software is designed only for one hospital, this will work as a silo. This will not be able to actually communicate with other hospital software. So we are also emphasizing in Bangladesh to have a standard environment of the software and IT, as well as interoperability between the hospitals, so that all the private and public hospitals can talk to each other, and the national system knows what is happening in the country. So what is the purpose of EOBP? So the purpose of EOBP is that actually it will have individual records of all the citizens living in the country. By this time, we have collected 120 million, that is about 40 individual records of citizens of Bangladesh who are living in the country. And we hope that by next 2 months, all the data will go into the computer. We can collect data for the urban population because we understand that the urban infrastructure is not uniform like what is happening in the rural area. The second one is the urban health is not the responsibility of Ministry of Health. This is the responsibility of Ministry of Local Government. So first of all, we need to get experience in the rural level, and from this experience actually we will take it to the urban area. Currently we are working in close collaboration with the Ministry of Local Government and the Bangladesh Bureau of Statistics, as well as the Prime Minister's Office, to have a national population register. So if a patient goes to community clinic or any of the facilities, the health facility will receive the record of the citizen, and they will update the record there, health record, for example. If this patient is referred to any higher facility, so this is recorded there, and the higher facility will know that the patient is coming, and they will have to respond to the patient. They will have to prepare themselves to receive the patient. The second, if in any facility, sometimes in the outdoor stage, or in the inpatient when we actually discharge the patient, we advise, okay, come to the hospital after 1 week, or come to the hospital after 15 days, or come to the hospital after 1 month. So we will provide reminder to the patient. If the patient fails to come to have a reasonable picture in the country so that this system works. I think my explanation will satisfy your question. But the first and fundamental question is that you have to make your health workforce responsible. You will have to make your health workforce understand the need of the people, and they should be careful to tackle up the need of the people. Thank you very much.
Thank you, sir. Now we is the chairperson of the session.